So, childhood cataracts, leading cause of treatable childhood blindness in the United States. We estimate about 3 to 4 kids out of every 10,000 live births will have this condition. So, in an average year, about 1,500 or up of kids born with congenital cataracts. Without timely treatment, deprivational amblyopia may be irreversible at some point. So whether it's unilateral or bilateral, there's obvious significant impact to the quality of life of this child, their socioeconomic potential, and also impact to the family and society at large. So when you treat these kids, you're not only restoring vision, you're also giving back decades, many decades of vision in this person's life. And not all treatment is surgical, so there's a lot of things we do for these kids that does not involve surgery and have excellent results. So how do we usually see these kids? One huge thing is the abnormal red reflex or leukocoria. And I'll talk about how it's not always leukocoria. So there's vision, there is newborn screening done when the child is born and also by pediatricians at their well visits. A lot of times it's picked up there. And sometimes now we have parents who call us. They see it on photos of the child, especially small cataracts. They're the first ones to make that diagnosis. When they're a little bit older, they go through vision screening, usually around 12 months to 18 months of age. Vision screening can start and immediately thereafter. When they reach school age, schools will also provide that service. So if they fail vision screening, they may also come to us. Sometimes there's a family history. Their parents, grandparents have had cataract surgery as a child. And even though they don't see necessarily anything yet, they'll come in and see us to make sure things are okay. And then there's a group of kids that come to us that actually have no idea that it may be a cataract. They come in because there's new strabismus, the eye is crossing, or sensory exotropia, the eye is going out. And nystagmus, sometimes that's the first sign that people have noticed. And you can see that as early as 1 to 2 months of age, and usually a sign that there is significant amblyopia present already. And on the flip side, sometimes we see these very early on fetal ultrasounds. I've had cases of bilateral congenital cataracts that the parents have known about on fetal ultrasound, and they come in soon after birth. So you can see that as early as 14 weeks.